Republican leaders delayed today's planned vote on the bill to repeal Obamacare. The vote could come as early as tomorrow. If it passes, how will it affect you?
Alex Michelson is here now with an attorney who happens to specialize in health care.
Yeah, joining us live is Harry Nelson. He is the co-author of this brand new book. It's called From Obamacare to Trump Care, Why You Should Care. So let's begin with that question. Harry Nelson, thanks for joining us.
Yeah, thanks, Alex.
So the bottom line question, why should you care?
So these changes are going to affect every American. Certain people, if you're somebody who, one of the 5 million Californians who got Medicaid in the last 5 years, or if you're one of those 2 million or so who got subsidized coverage on the insurance exchanges, it has a big effect on you, but everybody is ultimately affected by the way that our insurance system and how we pay for health care is changing.
Yeah, because some of the big changes, obviously, they would get rid of the individual mandate, and then there'd be big changes for Medicaid expansion. You're saying there's also a big philosophical difference here, too.
Yeah, the Republicans and the Democrats see this issue in really different terms. The Affordable Care Act was all about expanding access to care. Medicaid for the poorest Americans, and then for the middle class, subsidies for people who are uninsured to buy coverage on the exchange. The Republicans see this as a cost issue. The issue is bringing the affordability of health care down by making the market work, by cutting taxes and essentially letting people become better consumers and fixing pricing that way.
Okay, well, at this point, it's unclear whether this Republican bill will pass. They say there's going to be a vote tomorrow. They say it's going to pass. If it does, let's talk about the winners and losers, because every legislation, there are winners and losers. Let's put that up on the screen. Some of the winners and losers. You say that insurance companies, direct retail health, and digital health would be some of the winners. Why?
Sure. So insurance companies are, we think, the big victors under this bill. The insurance companies have been, under Obamacare, they were had their profits fixed at 15%. By the law, by the medical loss ratio, and they also were subject to all these requirements of minimum essential benefits. So the Republicans want the insurance companies to be able, they want to deregulate. They want insurance companies to have the freedom to really figure out what's profitable and what's not, and to offer low cost, low benefit coverage. So we think they're going to have tons of options. The CEOs had their pay deductible only to $500,000. The Republicans want to let insurance company CEOs have their pay unrestricted. And then in the retail space, we think that low-cost options that bypass insurance are going to do better. So think CVS Minute Clinic. That was an option. If you had insurance, there's no reason why you'd reach into your wallet and buy healthcare before. But now, cheap healthcare at retail level, and also online, companies like Teladoc, the big providers, those companies, in the past, people didn't necessarily use those because it was why spend out of pocket when you had insurance? Now, going into your pocket for affordable options is attractive.
Now let's talk about some of the losers now. You say that middle-class patients, people stuck in the middle, hospitals and addiction treatment providers. Why?
Yeah, so the middle class, is often the forgotten group in this conversation. The poorest Americans who are getting Medicaid, there's a lot of attention being paid in Sacramento to possibly filling the gap of whatever Washington, D.C. takes away. But for all those people in the middle, the government is giving them an option of tax credits, but we think it's going to be a lot more expensive, and there's going to be challenges. They're going to be forced to go to the emergency room to get their health care. So the other big loser is hospitals. Hospitals are going to, those emergency rooms are going to fill up with a lot more uninsured patients, and we're returning to a time when hospitals have to figure out how to do that. And finally, one of the things that the Affordable Care Act did was it expanded a lot of kinds of coverage that weren't traditional to insurance, and addiction treatment was probably the biggest category. So that was something that Obamacare mandated had to be provided, and now the Republicans are taking away that and allowing the insurance companies to narrow the benefit, and which is going to be hard for the providers of addiction treatment.
Well, thank you for coming in, because I think there's so much discussion about the politics of all this. We forget that this really affects millions of people's lives, and we appreciate you sharing your perspective. And for
Alex,
people that
thanks.
are interested in reading a lot more about your perspective, they can read it at your book. There it is right there. It is From Obamacare to Trump Care, Why You Should Care. It's available now on Amazon. It's on Kindle. And you said a unnamed senator bought it for every one of his Senate colleagues. So it's been delivered to everyone on the Senate. So we'll see if they read that as well, as they potentially have this decision next.
Thanks, Alex.
All right, thank you
What
guys.
a great title.
No kidding.
Right. Thank you so
Very
much.
good.
Thank you.
Thanks for clearing that up.